If you want to learn more about bipolar I disorder, this is the video for you. We'll cover the diagnostic criteria for depressive and manic episodes, risk factors for bipolar I disorder, and more. This is a diagnosis in the category of bipolar and related disorders in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition text revision, or the DSM-5 TR for short. But before we get into all that, let me introduce myself. My name is Keegan. I have a master's degree in counseling, and I'm a licensed professional counselor. I make videos like this to help you better understand various concepts in the world of psychology, counseling, and mental health. Keep in mind that engaging with this channel does not constitute a therapist-client relationship. This content is for educational and entertainment purposes. This does not substitute or replace professional mental health care. This video includes discussion of suicide. If you're experiencing suicidal thoughts or needing support with your mental health, please call or text 988 or go to your nearest emergency room. Please take care while watching. Like many mental health diagnoses, bipolar disorder is one of those things that people will use in their day-to-day language. They will say things like, "I'm so bipolar," or "that person seems so bipolar," when what they're really describing is what seems to be a sudden shift in someone's mood. While bipolar disorder does involve changes in mood, this is different than what most people are referring to in their day-to-day language. So if you ever catch yourself referring to general changes in someone's mood that appear pretty sudden as bipolar, it may be best to try to rephrase what you're saying to be more appropriate so that you're not invalidating the experience of somebody who does actually have bipolar disorder. Because as you'll see with bipolar I disorder, this is a diagnosis that can have significant impacts on people's lives. Let's start by discussing generally what bipolar I disorder is. We all have changes that can occur with our mood, where we can have a lower mood at times and a better mood at other times. Overall though, our moods tend to be fairly consistent. For some people though, they may have larger drops in their mood. This is when a person might be diagnosed with a depressive disorder. When a person has a mood that is significantly more elevated, this might be referred to as mania or a manic episode. With bipolar I disorder, the person will experience shifts in their mood that drop into low depressive episodes and then increase also to times where they're experiencing mania or manic episodes. Now that we have that understanding that depression are the dips in mood and mania are the elevations in mood, let's talk about the actual diagnostic criteria for bipolar I disorder. For a depressive episode, there are 9 symptoms. To meet criteria for a depressive episode, a person has to have at least 5 of these symptoms that occur within the same 2-week period that are a significant decrease from their usual mood. Importantly, these symptoms need to be present most of the day, nearly every day during this time. The first symptom is a depressed mood, which could be feelings of sadness or a feeling of being empty. This is something that the person may notice themselves experiencing or that others might notice the person experiencing as well. Second, the interest or pleasure that they get from usual things in their lives or activities that they generally enjoy has decreased or maybe gone away entirely. Third, they may experience changes in weight or appetite, and these changes may be an increase or a decrease. Importantly though, if the person has been dieting to try to lose weight, these changes should not be attributed to that. Fourth, the person might sleep more or experience sleeplessness. So it might be that they're sleeping all the time, or it could be the opposite, that they're struggling to fall asleep or stay asleep. The fifth symptom we again see on both ends, where they might experience restlessness, where they're just wanting to move or feeling like they need to move, or they may have feelings of being lethargic, where it might feel as though their body is really heavy and it's hard for them to move. Sixth, the person may have feelings of fatigue or low energy. Even if they're sleeping a lot, where we would think maybe they should have a lot of energy from sleeping that much, it may still be that they're struggling with having enough energy to feel as though they can get through the day. Seventh, they may experience strong feelings of guilt, worthlessness, hopelessness, or helplessness. The eighth symptom is that the person might have difficulty thinking, concentrating, or making decisions. Ninth, some people may notice thoughts of death, suicidal ideation, or may have plans or intentions of ending their life. These are the 9 symptoms that we look for with depressive episodes. Now let's move on to manic episodes, which are required as part of bipolar I disorder. But first, if you're enjoying this video and finding it helpful, please help me out by giving it a like and subscribing. With manic episodes, these are the times where the person has an elevated mood. They may be feeling their mood or experiencing their emotions in a more elevated or stronger way than typical. For some people, their mood may even be more irritable. Often during these times, their energy or activity levels will be increased from their usual levels. These episodes need to last at least a week. However, if at any point during this episode the person is hospitalized due to these symptoms, the 1-week timeline no longer matters at that point. These symptoms also need to severely impact the person's ability to function at work, at home, or in life. During these times of elevated mood, the person needs to have at least 3 of the following symptoms. But if the person is primarily experiencing an irritable mood, then they need to have at least 4 of these symptoms. First is an increase in self-esteem or feelings of grandiosity. This is where the person might be experiencing higher self-confidence than is their typical, possibly thinking things like they're the best or that they're the smartest person related to a specific topic. Second is a decreased need for sleep. Note though that this is not necessarily that they can't sleep, but more so that they're having a decreased need for sleep, where they're not feeling as though sleep is necessary for them or where they can function off of very little sleep. And when I say that they can function off of very little sleep, I don't mean that they can get by. I mean that they sleep very little and then they feel very rested. In some cases, people may stay up for multiple days and feel as though they don't need to sleep. The third symptom is that they might become more talkative or have what we call pressured speech. With pressured speech, it can appear as though they have so much to say that they can't stop themselves from saying it. When you talk to somebody with pressured speech, it can be nearly impossible for you to cut in to say something, where you may even just need to start interrupting or talking over the person to speak. Fourth, the person might experience flight of ideas or racing thoughts. This is where a person has thoughts or ideas that are racing through their minds, where they can have many different thoughts or ideas in a very short amount of time, but none of these stick around for too long before the next one pops up. Fifth, they may be easily distractible, where they can get drawn into unimportant things. Sixth, the person may experience restlessness, where they're moving a lot and there's maybe no specific rhyme or reason to the movement other than to give them that sense that they are moving. For some people though, they may have an increase in goal-directed activity, where they become very focused and fixated on specific goals or tasks. The seventh symptom is involvement in activities that may have undesirable consequences or that pose increased risk of harm. Examples of this might include shopping sprees where they're spending lots of money, sexual indiscretions where they're behaving sexually in ways that they wouldn't during their typical mood, substance use where they're using substances that they typically wouldn't, or making poor investments that they would not make while they're at their baseline. So those are the symptoms for a manic episode. Let's talk some about bipolar I disorder in general, as well as some of the risk factors for this diagnosis. For people in the United States, bipolar I disorder will typically appear between the ages of 20 to 30. On average, women experience their first episode at 21 years old, while men tend to experience their first episode at 23 years old. Keep in mind though that those are only averages, and some people may experience their first episode at a younger age, and some at an older age. In fact, there have been some cases where the onset of this diagnosis has occurred during the person's 60s or 70s. There are various risk factors for bipolar disorder. Keep in mind though that these do not mean that the person will get bipolar disorder. Instead, risk factors simply mean that the person is at a somewhat greater chance of developing this diagnosis at some point in their life. Early childhood adversity is one risk factor for bipolar disorder. This can include conflict in the family, having a parent who experiences mental health difficulties, or having emotionally traumatic experiences in childhood. Stressful life events can also increase the risk of bipolar disorder. Generally, events that are more negative increase the chances of a depressive episode, while events that are more positive tend to trigger manic episodes. Negative episodes might be a death in the family, while positive episodes might be achieving a goal such as graduating or getting married. Genetics are a key risk factor for bipolar disorder as well. In the general population, there's a 1% chance of developing bipolar disorder. However, if a first-degree relative has bipolar disorder, such as a parent, the chances of developing bipolar disorder then increase to 5 to 10%. That's an overview of bipolar I disorder. As you may have guessed, there are other bipolar disorders as well. These include bipolar II disorder, cyclothymic disorder, and more. If you'd like to learn about any of these others, let me know in the comments. That brings us to the end of this video. I hope that you found it helpful. While you're here, make sure that you check out some of the other videos on my channel. Thank you so much for watching.